Hello, good evening, everyone, and welcome to another one of our Facebook Live sessions. Right, my name is Bev, and I'm honored to be your host for tonight's sessions. And of course, tonight's topic we're talking about the different types of head and neck cancer, right? The warning signs and the treatments available. And it's specifically brought to you by 365 Cancer Prevention Society, our new cancer education partner, Pfizer, and our esteemed medical partner, Icon Cancer Center. So please, if you can see on the screen right now, please like and share and comment on all of our social media pages so that it can reach out to more people. So tonight's session is a very interesting one because we not only have one of our usual speaker, we also have a guest speaker as well. So please take this time to gather your friends and family to listen in. All right. So 365 Cancer Prevention Society was founded in 2003, right, as a social service agency with IPC status, and we are a full-fledged member of the NCSS. The society's mission is to serve the community through holistic cancer prevention measures, and this is accomplished through health and nutrition education, the promotion of healthy lifestyle, and our lymphatic detox exercises. We also provide practical and emotional support through our care and support team for our members and their family members in this battle against cancer. So we also do residential and hospital visitation, counseling, and wellness services. So please remember that you're never alone in this fight against cancer. We hope that you can join our community in this fight. So for more information, do visit our official website and follow us on our social media platform. Before we begin tonight's talk, I'd just like to give a little disclaimer. So kindly note that all information shared at this event by the speaker and 365 CPS are for general information only and subjected to changes. So do consult your doctor for personalized and detailed medical advice. Thank you. So to mark Colorectal Cancer Awareness Month in March this year, okay, so Icon Cancer Center and 365 CPS, we have decided to join together and come together to prepare this My First Colonoscopy campaign. Okay, so it's also partnered with Society of Colorectal Surgeons and StarMed Specialty Center. So the campaigns aim to support individuals aged 45 to 70 from low-income family and those who are at a higher risk due to family history and symptoms to do a fast-track sponsored colonoscopy by experienced surgeon from the Society of Colorectal Surgeons. And this is complete with a pre and post GP medical consultation at StarMed Specialist Center. So meaning to say, beneficiaries of this sponsored colonoscopy don't have to wait for months on end, right, for an appointment to see a doctor and to do the scope. Everything is done at StarMed Specialist Center by qualified and experienced doctor. From the seeing the doctor all the way to doing a scope is all done in a matter of weeks. And you guys are the one that can make a difference and making all this possible. So you can do your part by donating towards this campaign. The details are currently now on screen. So all you need to do is to scan the QR code and check out online portals such as Giving SG and Give Asia for more information. So if you do wish to find out more about Icon Cancer Center and Society of Colorectal Surgeons or StarMed, so do feel free to check out their website and social media pages. Now, before we begin tonight's talk, I would like to introduce tonight's speaker. So, Dr. Patricia Koh, right, with over 20 years of experience, she's a medical oncologist, right, who is practicing at Mount Elizabeth Novena, Glen Eagles, and Mount Alvernia Hospital, Singapore. She has a subspecialty interest in lung, head, and neck, and of course, breast and gastrointestinal cancers. Next, we also have Dr. Luke Tan, and he enjoys his practice in specialty of ear, nose, throat, head and neck cancer surgery, and has a particular passion for thyroid surgery. He was awarded a fellowship in head and neck oncology surgery in Galveston, Texas, which is a 2-year intensive training program that was accredited to him by the American Joint Council of Head and Neck Surgeons. We are honored and privileged to have both doctors with us tonight. So without further ado, let us welcome Dr. Koh and Dr. Tan to the screen right now.
Hi, everybody. Good evening.
Hi, Dr. Koh.
Hi, everyone.
Hi, Dr. Tan. Right. So thank you very much for joining us tonight and sharing all this information with everyone here. So I will be now taking my break and Dr. Tan will be joining me. So Dr. Koh will be starting us off with sharing first and followed by Dr. Tan later on. So over to you right now, Dr. Koh.
Thank you, everybody. I'll first start off, and thanks for the kind introduction, Beth. Thanks for joining us tonight. So head and neck cancers is a very big topic because it comprises a lot of different types of cancer. But for the interest of time tonight, I will talk mainly about head and neck cancers and nasopharyngeal cancers. So I'll start off with just explaining once again what is actually cancer. In a normal healthy state, we have a balance between cell growth and death in our body. So cell death and cell growth coexist and is in equilibrium. However, when old and damaged cells continue to survive instead of dying, these extra abnormal cells then start to divide without stopping, and they will then form a group of abnormal cells called tumors. So this is when, therefore, self-growth exceeds cell death, and the abnormal cells become what we call cancer. These tumors can be malignant, and therefore they are labeled as cancerous, and they have the ability to spread to different parts of our body. A tumor, however, can also be benign or non-cancerous, and it's called benign because it does not have the ability to spread to other parts of the body. So in this talk, we are mainly focusing obviously on malignant cancerous tumors of the head and neck region. So head and neck, what is head and neck cancers? Basically, it is the abnormal cancerous malignant cells that arises from all these areas in our head and neck region. Dr. Liu Tan will definitely go through in more detail of all these specific regions. And how common is it in Singapore? Actually, head and neck itself, the other head and neck cancers it's not as common, but the most common in males in Singapore causing mortality is nasopharyngeal cancer. In females, so in Singapore, about 800 new cases of head and neck cancers are diagnosed every year. Again, as I said, most common among men is nasopharyngeal cancer, also commonly known as nose cancer. Globally, head and neck cancer is the 6th most common cancer. In females, though, thyroid cancer is actually the most common cancer, head and neck cancer, but not nasopharyngeal cancer. So there's a difference between the two genders. So I'll move on now to risk factors, and I think one of my slides skipped up just now, so I'll move back later. So what are the risk factors pertaining to head and neck cancers? Most important ones is tobacco or smoking, any form of tobacco, including chewing batter leaves. In other countries, you have smoking snuff, or basically putting snuff in your mouth. All this are related to increased risk of head and neck cancer. Alcohol as well. So excessive drinking in women and men, there are guidelines as to what our limits are. So women, 1 standard drink per day, men up to 2. Doesn't mean that you can save for the whole week and then binge drink at the end of the week. So it doesn't mean that for women you can drink 7 standard drinks at the end of the week. Binge drinking is not considered within the normal guidelines. Alcohol is definitely causes increased risk of head and neck cancer. As I said, smoking is the cause of almost up to 90% of mouth cancers attributed to tobacco use or alcohol consumption. Other risk factors are being overweight, and in nasopharyngeal cancer, the consumption of salted fish is a known risk factors, and it's been advised not to consume too much salted fish, especially in young children. The other slide which I moved up is other risk factors are viruses. The human papillomavirus, HPV, a sexually transmitted virus, causes almost 70% of oropharyngeal cancers. The other one is called Epstein-Barr virus, what we call infectious mononucleosis. It happens quite commonly in young people, but the young people usually tend to be able to clear this virus quite well. And so this is not usually, it is normally not active in our bodies because even though we may be infected with it, we are able to clear it. But those who may not be able to clear it so well will have an increased risk of developing head and neck cancer or nasopharyngeal cancers later on. The other risk factors are what we call field cancerization. And again, this is due to exposure to tobacco and alcohol. It can cause another second primary, or it can increase the risk of recurrence. And chronic trauma from just sharp teeth hurting your mouth or your jaws or your mouth mucosa and ill-fitting dentures can also cause oral cavity squamous cell carcinoma. So the signs and symptoms are very varied because it's dependent on the location of the mouth, of the lesion, okay? So for example, in the mouth, you may notice that there's a white or red sore that is persistent. It does not heal. So most of the time, mouth ulcers come and go. We may have one, after a few days it will go, but one that does not heal on the gums, tongue, or lining of the mouth should lead you to see a doctor. So also swelling the jaw, unusual bleeding or persistent pain in the mouth, a lump or tickling that does not go away, persistent problems with dentures can also suggest that there is something in your mouth that is not going away, therefore your dentures are ill-fitting. So these are potential signs and symptoms of cancers in the oral cavity or in the mouth. However, if the lesion happens in the back of your throat, so which is down this area, the pharynx, which includes oral and hypopharynx, so this down from the base of the tongue to the hypopharynx, you may have trouble talking or speaking. You may have trouble chewing or swallowing food. You have a feeling that maybe something is caught in your throat, a pain in the throat that don't go away, and sometimes even pain or ringing in the ears or trouble hearing. If you have something in the larynx, which is what we normally known as the voice box in this area, then you may have pain when swallowing, pain in the ears, or you may have a change in your voice, in the nature of your voice. If you have something in the nasal cavity or in the nasopharynx, then you may have blocked sinuses that don't clear. Sinus infections that you may usually come and go with antibiotics, these may not respond to treatment with normal antibiotics. You may have persistent bleeding through the nose that does not stop. Headaches are sometimes an indication. Pain and swelling around the eyes, pain in the upper teeth, and again, problems with dentures could also be another indication. So as you can see, it's very varied and it really depends on the area. So whatever is abnormal and does not go away and is persistent, one should seek the attention of a doctor for further evaluation of the problem. Other issues could be due to, for example, noticing a lump in your neck. This could be due to spread to the lymph nodes from one of the head and neck regions. Again, thyroid cancers, a visible hard neck lump, or sometimes incidental finding radiologically when you go for other tests. Cancer in the temporal bone, so in the bone in the skull, that can cause pain in the ears, some discharge or impaired hearing, or something more localized such as a skin lesion can be seen as an ulcer, a pigmented lesion, or just some abnormal sensation that you may notice. So again, any of this should lead you to see a doctor. So are we able to screen for any of these cancers? So obviously, one of the most important things that we want to do is to prevent cancers. And are there screening tests for head and neck cancers? Unfortunately, there are none for the general population for head and neck cancers. There may be some more suitable for high risk patients, so suitable for individual level decision made together with the doctors for nasopharyngeal cancer. Sorry, NPC refers to nasopharyngeal cancer, or more commonly known as nose cancers. Now, a tumor marker called EBV, Epstein-Barr virus levels, can be considered for high-risk groups, meaning individuals with a first-degree relative, such as a parent or a sibling, with nasopharyngeal cancers. So we know that out of all the nasopharyngeal cancer patients, about 6 to 15% of them will have a family history, and they do have an increased risk compared to the general population in the same age group. So these patients may qualify and may be tumor markers such as EBV could be used as a screening test. But importantly, these tumor markers should be used in combination with nasopharyngoscopy to screen such high-risk individuals. They should not be used alone on its own, and they should be paired together with a nasopharyngoscopy, which is something that Dr. Luke Tan does very frequently, and he will elaborate later on. So for now, I'll pass the time over to Dr. Luke Tan, who will share more about the surgical options, how to make a diagnosis with regards to other head and neck cancers. Over to you, Dr. Tan.
Thank you, Dr. Koh. It's a pleasure to be here this evening. Thank you for everyone who is on screen, taking the time off on a Saturday evening to listen to this topic. It may well be that one of your family members or there's someone that you know may have this problem, which is why you're interested in knowing more. Thank 365 as well as Pfizer for supporting this together with ICON. I have no disclaimers to make. I want to focus on just one area because of the time constraint in what is this neck lump. So when somebody gets a neck lump, the immediate response is usually fear and concern. And of course, the major question behind that is, what is this neck lump cancerous? There are many types of neck lumps, and tonight, in the time that I have, I will cover three areas. One of those in the salivary glands, two, those of the lymph nodes, and three, those related to thyroid tumors that Dr. Koh had already alluded to. I want to simplify it for you so that you can take it home where you are right now to apply it. So generally speaking, lymph nodes and salivary glands are in the upper part of the neck. Lymph nodes can be in any part, but salivary glands are definitely in the upper part of the neck. The lower neck lumps tend to come from the thyroid gland and sometimes the lymph nodes. So if you look at this picture, this gentleman obviously has a swelling around the upper part of his neck, just below his ears. And so this is what we call a mass at the angle of the jaw. And so this is quite a common problem. And so what can it be? Before I go there, I just want to say that, all of us are different colored skins of different origins and background, but underneath that, we are all the same. And so this is a picture of the center of the neck. And next to the center of the neck, I'm going to build up a picture that is going from inside out. Next is an artery that's next to the throat that we have. Next to the artery is a vein and nerves in yellow here. And then on top of that, a vein as well. So I've introduced you a few vessels and nerves, but the lymph node is what I want to emphasize to you. And the lymph nodes actually occur around the veins. So the lymph nodes are structures that usually happen to be sited around the veins because they also drain fluid systems from the rest of the body. And so as we build up this picture, then I'm going to show you three other structures, and the veins, the arteries, the nerves, and lymph nodes are actually covered by the green colored muscle. And in front of this is where we're talking about this yellow structure here, the parotid gland or the salivary gland, and the purple one called the submandibular gland. So as I go and build up these structures, one by one, you begin to get an idea as I'm teaching you how the anatomy of the neck is. And finally, the last one that I'm going to show you is the one in red. And this one is where the thyroid gland is. So the thyroid gland is in the lower front part of the neck and is usually quite easy to diagnose. So this gentleman, now that I have shown you the picture, you will realize is in the upper part of the neck. It is likely to be area of the salivary gland or the lymph node. So if we were to take this out, this is how you will look like on the slide of the specimen. The area in dark purple is the normal salivary glands with saliva cavity, so to speak, in white. And the tumor is the part that is in the middle that looks a bit more pinkish. Uh, just to give you a heads up that the next slide is a bit unpleasant, I'm going to show you the nerves that make it very hard to do the surgery in this area. So, unfortunately, the nerve that runs through the salivary gland moves our eyes and our mouth and our chin. And so, this is a picture of the salivary gland having been removed. And I'm going to show you the frontal, the zygomatic, the buccal, the marginal, and cervical branch. This is our medical uh, terminology. And basically, these are the nerves that move the different parts of the eyes and the mouth and the neck. So, that is the area of the salivary gland. Now I'm going to talk a little bit about the lymph nodes. Dr. Patricia just now alluded to many of the structures in the ear, the nose, the throat, the voice box, and all of them with cancers can shift and spread to the lymph nodes. So I just want to revise this area and remember about the lymph nodes. And so I'm going to next show you a picture of a gentleman with a area of the lymph node. So he has a lymph node that is enlarged. So when he is enlarged in this area, you can see the area behind that black line. So it can be coming from anywhere. It can be coming from the back of the nose, the back of the throat, his tonsil, his voice box. But as Dr. Patricia has mentioned, the commonest one is actually nose cancer. So this is when I see a patient like this that walks into the clinic. First of all, I have to exclude that he doesn't have what we call nasopharyngeal cancer or nose cancer. And so it can be a cancer that is only from the lymph node, in which case it is from a lymphoma, or it can be a cancer in any part of the throat. So from the doctor's point of view, our job is to make sure that we find where is the original site of this cancer. Sometimes it can be from the nose, it can be from the mouth, the tongue, the throat, and very rarely at that area it can be from the thyroid as well. The bar in yellow and the bar in red shows what is the commonest presentation of a patient with nose cancer. The commonest presentation is actually neck lumps. And then the other one would be blood in the saliva. So if you want to take home something this evening, remember that when you have a neck lump in your neck, if it is due to a cancer, the commonest cause is nose cancer, and the other early symptom is blood in the saliva. Deafness is one of the possibilities, and you realize that bleeding nose is actually only the fourth commonest. So this is an example of a ear that has got little bubbles behind it, and the bubbles is because of the fluid accumulating behind the eardrum that is due to the blockage of the nose by the nose tumor causing the fluid to remain there. This is a normal looking nose at the back of the nose to give you some reference, although most people have not ever seen this. And this is an example of a tumor and a biopsy is being done. A biopsy is where we take a little bit of the tissue from the specimen and we send it to confirm whether there is cancer that is present. So I've covered with you two areas. One is salivary gland and two lymph nodes. And then the next one I'm going to cover with you is the thyroid gland. Most of you would have seen patients with neck swellings, and some of these neck swellings, have been there for a long time. And how do you know? Because the skin over the gland has stretched over many years, and there is no sense of inflammation or swelling in the region. The thyroid gland can actually go from a small thyroid gland at the bottom left of the picture all the way to a big thyroid gland over a couple of years. And usually these are non-cancerous. Usually these are non-cancerous, as I repeat, and the majority of them can be left alone. However, there are some times when the cancer, there are features within the thyroid gland where there are features of cancers like a bit of calcification and then what we call hypoechogenicity on ultrasound or CT scan, and these are suspicious of thyroid cancer. This you will only know if there's investigations that were done. But the most important thing in thyroid cancer is actually this yellow line, which is actually a nerve. It's a nerve to the voice box. And those of you who have been exposed to patients or friends or who have thyroid surgery, the critical point is the surgeon's ability to preserve this nerve successfully so that the voice is not affected. Unfortunately, sometimes it can't be true. As an example, here you can see there's a tumor on the top, and there's actually a nerve that is going right through the cancer, and so we have no choice but to remove it. Sometimes the thyroid gland, although it's benign and non-cancerous, can be so big that it's pushing onto the windpipe that causes breathing problems. In those cases, we have no choice. You can see how far this mass on the thyroid has pushed the windpipe in the black space all the way to the other side. And so the only option is to decompress, is to take out this thyroid gland and actually remove it to relieve the pressure. And finally, some of you may hear about a scan called a PET scan. It is a commonly done scan nowadays for staging for most cancers. It is not commonly done though for thyroid cancers. It is commonly done for nose cancers as well as throat cancers. And here is a bright spot. The bright spot denotes an area where there is uptake of sugar. We actually inject a certain sugar with activity, a bright localizing activity here. And so the cancers tend to take up more sugar because they are multiplying. And so this is called a PET scan for your information. So I've briefly covered in the last 15 or 20 minutes or so some of the upper neck lumps, the salivary gland lymph nodes, as well as the thyroid lumps. So if you were to walk away tonight, hopefully you will remember some of these things that I've shared with you. And be happy to entertain further questions. I understand it's a Saturday night, so we want to give you as much information for the time that you're spending with us. Thank you, and I'll pass this time back to Dr. Koh.
Thank you, Dr. Tan, for the sharing, and especially all those pictures to help us visualize this fairly difficult topic better. So I think Dr. Tan has shared with us the different cancers of the different parts of head and neck cancer, such as the thyroid cancer, which I wouldn't go on to elaborate. And what I would share with you would be the non-surgical treatment options for the other head and neck cancers, including nasopharyngeal cancers. So the three main treatment options for head and neck cancer, as you can see, is surgery, which Dr. Tan had spoken about, radiotherapy, chemotherapy, and other systemic treatments. So as Dr. Tan had mentioned, usually after we diagnose the cancer, usually done by a surgeon such as Dr. Tan, then we will need to decide whether how far is the extent of the tumor locally. And sometimes we use an MRI, a scan called MRI, and we sometimes use a PET CT, which Dr. Tan had explained, to see if the cancer has spread to other parts of the body. Using the PET CT uses a radioisotope, which actively takes up sugar. And so in active cells, such as cancer cells, it can light up, and therefore we will be able to see if the cancer has spread to the bones or to the lungs, and so on and so forth. In terms of surgical, as well as other radiotherapy workup, we do send the patients for dental check. We also look at the patient's nutrition, speech and swallowing evaluation, because as you can see, some of the tumors can cause swallowing problems. And if the patient is still currently a smoker, we would strongly advise them to stop smoking, because if you continue to smoke, even if we treat you, there is a higher risk of the cancer recurring or a second head and neck cancer recurring. So I'll talk first about locally advanced head and neck cancers, meaning these are cancers that are in the local region or they're spread to the neck. As Dr. Tan had showed, they present with neck lumps, referring to the lymph nodes. So if they haven't spread to the lymph nodes, sometimes surgery alone is a good option. Sometimes chemotherapy and radiation for early nasopharyngeal cancers. Sometimes surgery followed by radiation and chemotherapy. And if surgery is not possible, again, chemotherapy and radiotherapy as a combination is a treatment option for these cancers. Again, there is many different types of head and neck cancers, and the treatment is then very tailored to the particular region whereby these head and neck cancers occur. So I'll touch briefly on radiotherapy, even though I'm not a radiation oncologist, but radiotherapy is really giving X-rays to that region. And usually what will happen is you do a scan, the radiation oncologist would then do what we call planning of the area where the tumor is. We do now have better radiotherapy, such as image-guided radiation. And so in that sense, we can avoid giving radiotherapy to unwanted regions, such as salivary glands. And so therefore, it is a much better technique given now compared to, say, 10, 15 years ago. So in terms of advanced or metastatic head and neck cancers, meaning head and neck cancers that have spread out of the region, and therefore surgery or local therapy is not an option, what are the options we have to try and control the cancer? So chemotherapy is something that we all have heard of and we all know of. That is one of the treatment options. Targeted therapy, and more recently, immunotherapy is one of the new kids on the block for treatment. So chemotherapy, we have all heard extensively about this treatment. It is drug treatment given as a drip or infusion. It kills actively growing cells such as cancer cells, and it does harm some normal cells, and this would lead to some side effects such as tiredness, low white blood cells, fatigue, and so on. However, just to allay all your fears, chemotherapy nowadays is not quite the same as what we all think about. We have many drugs that can prevent nausea and vomiting, and we have many supportive drugs that can help patients tolerate the chemotherapy better. In addition, we do have better chemotherapy with fewer side effects. So the vision of people throwing up over the bed is no longer really existent. As I mentioned, immunotherapy is the new kid on the block. And although it is considered new, it has been around since 2004. So we do have had quite a lot of experience with it, but it has been found to be increasingly useful in many different stages of cancers, as well as head and neck cancers. So what is immunotherapy? It is a treatment that uses one's immune system to fight cancers. And how is this done? It is done by first either stimulating your own immune system to work harder or smarter to attack your cancer cells, or giving extra immune system components such as man-made immune system proteins to help fight the cancers. So why is it different, or why is it better, or is it really better? It is different because it has less side effects in terms of because it uses your own immune systems to selectively kill the cancer cells. So it has slightly fewer side effects, or if it has some side effects, it is very different from the chemotherapy kind of side effects. And it is also more specific. So in this diagram, I would show you what we mean. So in terms of immunotherapy, it causes the activation of your immune system so that it can help recognize and destroy the cancer cells. So what happens is your cancer cells are actually quite smart. They can camouflage themselves from one's immune system so that the immune system cannot recognize the cancer cells as a foreign object. So by giving this immunotherapy, it removes the camouflage of these cancer cells and therefore allows your own immune system to start attacking these cancer cells. So in this sense, the effect can be very effective and it can be more prolonged than just chemotherapy, because chemotherapy, obviously, after a while, the chemotherapy drugs would be removed from your body. But the immunotherapy activates your immune system, so it can keep attacking these cancer cells. And so recently, immunotherapy with chemotherapy has been approved for head and neck cancers, for advanced head and neck cancers, or immunotherapy alone in some of these tumors that have a very high level of what we call PD-L1, which is a marker for effectiveness with immunotherapy. So that is one of the newest advancements in treatment for head and neck cancers. The other treatment that we have available nowadays is what we call targeted therapy. So targeted therapy meaning a smart bomb versus a cluster bomb. Cluster bomb, such as chemotherapy, it kills all your cancer cells, but a smart bomb would be more targeted to the particular cancer cell that we want to attack. So in terms of targeted therapy in head and neck cancer, we have one is called anti-EGFR antibody. It's a drug called cetuximab, and is used in locally advanced type of head and neck cancer or with advanced or metastatic head and neck cancers. So it's because the head and neck cancers have something called this EGFR in the cancer cells that allows us to use this drug. So for example, what we have is head and neck cancer cells with what we call overexpressed EGFR, this particular molecule, and we have a drug called anti-EGFR antibody drug that therefore targets this EGFR in the cancer cells. And by blocking this EGFR pathway, it stops the cancer cells from growing, from spreading, and from producing more blood vessels. And therefore, it will kill off this cancer cell and stop it from further progression. So this is the idea behind targeted therapies in head and neck cancers and also in many other cancers nowadays. So I've introduced these three options for advanced cancers, advanced head and neck cancers, but really a multidisciplinary approach is really needed for head and neck cancers. So this is because there are some side effects that head and neck cancers patients experience, such as swallowing, speech problems, and breathing problems, not just because of the tumor, sometimes because of the surgery, as well as sometimes due to treatments such as radiation and chemotherapy. The extent of the surgery and the size of the tumor may also change one's facial appearance. So counseling and support for the patient is also very important to try and encourage them that this is part of the treatment and that it is something that we can help them with. Sometimes surgery requiring removal of the lymph nodes in the neck, as what Dr. Tan has mentioned, can sometimes result in swelling and stiffness of the shoulder and neck muscles, which needs to be treated by a physiotherapist. So we need to recognize this so that the patient can be more comfortable in their journey. Again, radiation and chemotherapy can affect things such as causing mouth ulcers, affecting the salivary gland, causing problems with a dry mouth, hearing loss, thyroid dysfunction, and so on. And hence, it's very important that such patients is very adequately supported by a team of speech therapists, a dietitian, because their nutrition will be affected by their swallowing issues, physiotherapists, counselors to help them, encourage them through this journey. And that's why partnering with 365 Cancer Prevention Society is very important, as they do provide psychological and mental support for our patients. And all this is important in addition to us, such as Dr. Liu Tan as a surgeon, a radiation oncologist, and a medical oncologist. So with that, I'd like to thank you for your time. Hopefully, you have some idea now of what head and neck cancer entails. It is a whirlwind trip. There's a lot of information, but we're happy to take any questions that you may have now. And I'd like to pass the time back to Beth. Over to you, Beth.
Yes, hi. Thank you, Dr. Koh, right, for your sharing. So now let's welcome Dr. Tan back on screen as well. All right, thank you both for your comprehensive and your informative content tonight. Now, I hope that everyone here has picked up some useful tips earlier on, and let's open the floor to some questions. Okay, so before we do that, right, just want to address one of the questions from Serena. Is some asking about this recording, right? So Serena, our recording will be on our Facebook page, so you can refer to the video later on our Facebook page after the event, right? So let's screen the floor for some questions, right? So we have one coming in right now. Okay, so it's about asking, is head and neck cancer more common in males or females? So maybe we can pose this question to Dr. Tan first, then maybe Dr. Koh will add on a little bit later on.
Yeah, hi. Thanks, Beth, for that question. It's a very important question, and it's linked very much to what Dr. Koh had shared with regards to the etiology or the causes. Unfortunately, head and neck cancer, to a large part, is related to a lifestyle, and one of them is smoking, and the other one is alcohol. And so these tend to be normally male traits, and so they are more common in men. There is one particular exception, and that is with thyroid disease, and that has also been shown by Dr. Koh with regards to incidents that thyroid cancer tend to be more common in women than men. Uh, yeah, thanks for the question. And Dr. Koh, do you have anything to share on that?
Yeah, I think as we said, smoking plays a very important part, and as it's true, that unfortunately males still smoke more than females, and smoking accounts for almost 70 to 90%, together with alcohol, of all head and neck cancers. So I think it is really because of this reason, not really because of any genetic or hereditary reasons, that it's more common in males compared to females. Yeah, except for thyroid cancer.
Okay, thank you, Dr. Koh and Dr. Tan, for answering that question. We have one from our audience right here, Hui right? She's asking about, my question is my TSH level, right, is above the normal reading. So what should I look out for, and how do I treat it? Maybe we can pose this question to Dr. Koh.
If your TSH is above the normal reading, you should actually see your GP or your what we call endocrinologist, because we also need to know whether the thyroxine level, so the free T4 or T3, whether it's affected or not. And we need to take the whole, all these readings into picture to know whether your thyroid is actually overactive or underactive, also, and so on and so forth. Yeah. So alone is not very indicative. We can't tell the condition based on the TSH level itself.
Okay.
And also whether there are symptoms that you're experiencing.
Thank you, Dr. Koh, for that answering that question. Hui, I hope we did answer your question, and thank you for asking it. Right. Next one is coming in from Maverick. Right. So is thyroid cancer hereditary in family? Maybe we can ask Dr. Luke.
Yeah, thanks for that question. And the short answer is, in a small part of the cases, the answer is yes. So we know of families. I certainly know of a few families that I've treated with many members in the family having thyroid cancer, and we know that there is a genetic link. There are several genetic links that we have actually identified, and one of them actually has been particularly useful because it has helped us to target certain therapies, and some of the therapies that actually Dr. Patricia has actually alluded to, and one of them is called a RET fusion gene, and that helps us with regards to selecting certain chemotherapy agents for those extensive disease. Other than that, the other areas more important for me, just for general knowledge, is that thyroid cancer is related to radiation exposure. So we saw a lot of children who were exposed during the Chernobyl broke out, or during the Chernobyl time in Europe, and there was a lot of thyroid cancers. And so there was a similar concern with those in Fukushima exposure as well. And we're watching for the data from there. Yeah, thank you.
I think there's another question by Yumin that says what causes thyroid cancer. So maybe it's linked to this,
Yes.
and whether it's more prevalent in female. Is it due to hormones? It's not It's not due to hormones, but as what Dr. Luke Tan has alluded to, there is no known true cause, but it is related to high levels of radiation and certain inherited genetic syndrome. But that's not very common.
All right. Thank you, Dr. Koh, for picking up that question, and thanks for asking them. Right. So next one is coming in from Serena. Right. You mentioned about salted fish. So what about fermented food? Is it also one of the cause for cancer? Maybe we can ask Dr. Koh.
Yeah. So salted fish has been linked to nasopharyngeal cancer, in particular, because actually nasopharyngeal cancer is more common in the Southeast Asian region. In regards to fermented food, we don't really have much evidence that whether it's related to cancer in general or not. We do know that processed food, however, such as processed meats, sausages, things like that, it can increase your risk of cancer if it's a regular part of your diet. So processed food is slightly different from fermented food. Unfortunately, we don't really have too much details about fermented food. If you are thinking about kimchi, that kind of thing, we don't have that much evidence on that.
Okay, thank you, Dr. Koh. Right. So, coming in from Freddie. Okay. So, hi, what is the acceptable range marker for the EBV blood test for seniors over 60 years? So, over to you, Dr. Luke Tan.
Yeah, I just want to take on the question together with what was a former question with regards to the salted fish. So, the Cantonese in south part of China, together in Hong Kong, has the highest incidence of nose cancer anywhere in the world, and that's also involves some of the Taiwanese, for which the data is coming out. So the salted fish has also in it nitrosamines, and that's one of the reasons why they believe that it's related to cancer production because of the impact of the chemical called nitrosamines. The other known factor is what Mr. Freddy has asked with regards to EBV. The three letters E, B, and V stands for the two names called Epstein and Barr, and the V stands for virus. It's like COVID virus. So this is Epstein and Barr, which was actually first alluded to and actually picked up in a cancer in African children called Burkitt's lymphoma. And it was actually through that association where they realized that that part of lymphoma looked very similar to the nose cancers that we see in southern part of China. And so they studied then the virus population in this group of patients. Over the last 30 to 40 years, there have been quite a lot of data on this area. But what is important is actually to realize that there are many different types of studies regarding the Epstein-Barr virus, but there's not a lot of long-term data that is associated with the different types of studies. So there are three studies that I would want to just highlight here. One is called the VCA, and the other one is called the EA. So these two are actually antibodies, just like when we get antibodies to a COVID infection, we get antibodies. So the EA is the only one to remember here. Is just remember it as early antigen, so you want to know early. So the EA is the one that is actually important. So when you ask a question about EBV blood test, this is one of the tests that we always want to look at, because if it's there, the chance of nose cancer is extremely high. Now there is also another one, the third one that I want to mention in the market, which is called the viral copies. So this is not studying the antibodies to the virus, but studying the actual number of viral copies in the blood. The data on this is still not very strong, so we don't really have clear data about what are the actual numbers above 60 years old. So I presume you want a clear answer, and unfortunately, I cannot give you a clear answer on that one. The only clear answer I can give you is that if your EA is positive, then you probably need to go and look at your nose through an ENT surgeon. Yeah, I don't know whether I'm missing something else. Maybe Patricia, you can add in.
No, I think, as I mentioned in my talk too, that actually it is not, it shouldn't be used as a general population screening tool, but it should be used in those with a higher risk factor individuals. So like as mentioned, family members who have NPC, nasopharyngeal cancers, then yes, you should do the serology test, and you should pair it with a nasopharyngeal scope. So basically that's the scope being put through the nose and looking inside your nasopharynx. So yeah, that's all I would mention. There is another virus which I mentioned in my talk, which is human papillomavirus, but we don't screen for that for head and neck cancers. It's only useful when you have it, and then we test for it, and then we can use it to determine the treatment and your prognosis. Yeah.
Okay, thank you. So we do have a follow-up questions from Hui as well, right? So maybe Dr. Koh can answer this. So about this experiencing blocked nose after radiation treatment, right? So besides using the nose washing solution, right, how do I better manage it?
I think this might be a better question for Dr. Luke, but
Okay.
nose
Sure, I'll
washing
take
will
that.
be the only one that I don't know.
Okay, so I think putting two and two together with the TSH and the fact that you had radiation treatment, I would surmise that you've had radiation treatment probably to your nose. And I'm going to try and answer your first question then, because the radiation treatment
Good
also
pickup.
involves the area of the base of the brain called the pituitary. And so when you radiate that area, sometimes the pituitary, which produces the TSH, may be abnormal. And so that may be the reason, or it may be related to your thyroid problem separately. Besides using water solution, actually there isn't a whole lot more, I'm sad to say to you, because there's the radiation affects the back of the nose, which is fairly far behind. And so one can really not wash it other than actually rinsing it. Most of my patients rinse at least twice a day. Majority of them do walk around with a bottle of water to kind of prevent the dryness of the throat. And there's a spray called a Sterimar spray that you can carry in your handbag around, and it is basically sterilized seawater that you can use to help manage your dryness and crusting. Yeah.
Thank you, Dr. Tan. Right, and thank you, Huya, for that question. So let's see. We have one coming in. Okay. So does a family of history of oral, throat, and tongue cancer actually increase my risk? So perhaps we can check with Dr. Ko or Dr. Tan would like to pick up this question.
Actually, if the family history is of a particular tongue and these people, your relatives had, the cause of it is due to smoking, then it may not, or tobacco use, then it may not be something that's hereditary. Okay. What we have seen is actually more the nasopharyngeal, the small percentage of thyroid cancers that have a genetic mutation, related to it. Whereas some of the other head and neck cancers are not really related to a hereditary mutation gene.
One trend coming out from oropharyngeal cancer is actually the presence of human papilloma virus infection, and this is result of unfortunately oral transmission of viruses, whether it should be sexual transfer or elsewhere. So that's one thing that may be in a way in families, but it's not technically a family
Yeah.
history as Dr. Ko has put out there. Yeah.
All right. Thank you, Dr. Ko and Dr. Tan, for answering that question. Okay, so I think this next question is about speech. So I think maybe Dr. Tan will answer it. So can the treatment for head and neck cancer affect speech?
Yeah, totally. I mean, it is can impact in terms of whether it be surgery, whether it be radiation, or whether it be even chemotherapy, because the speech is a very important part of our function. I mean, between eating and speaking, of course, eating is still more important because you need to live. But the second important function is speaking. And once the anatomy or the structures of the area is affected either by surgery or by radiation, usually the healing process will cause some form of scarring. And the scarring usually will affect speech. The other reason, other than anatomy, is sometimes the treatment, the surgery itself, or the radiation can cause injury to the nerves that supply to the speech function. And the speech function is not just the voice box, but also the tongue, the palate, and so forth. So, yeah, certainly it can infect it, which is why it's very important that the choice of treatment be tailored to the individual, and also the understanding of what is really critical to the patient before we embark on any treatment of any sort. Yeah.
Yeah, and I think that's as Dr. Tan said, the tailoring of the treatment is extremely important. That's why my last slide saying that a multidisciplinary team is very important, because at the end of the day, we want to cure the patient, but we also want to make sure that the patient has a fair quality of life, right? So we do need to make the best treatment option choice for that patient, and as well as making sure that we give him the best, him or her, the best cure rates.
Right. Thank you, Dr. Koh and Dr. Tan, for answering that. So next question is, so this in all themes of talking about this neck cancer today. So one of the question is naturally asking, right? So does head and neck cancer actually have a recurrence? Maybe you can check with Dr. Koh.
So yes, definitely. If you have a high risk head and neck cancer, meaning like a lot of lymph nodes are involved, then your risk of recurrence is high despite all the treatments that we may give you, higher. So then your risk of recurrence is possible. The other thing that we also see, even despite after 10, 20, or even I recently have a patient who I saw a second primary head and neck cancer after 30 years of the first head and neck cancer. And this is what I mentioned before, what we call field cancerization, meaning that because of the exposure to tobacco or alcohol, it's in the system, right? So these cancers can, again, the genes these genes can mutate in your cells and change and become cancerous again. So we do see second head and neck cancers even after a long time.
Right. Thank you, Dr. Koh. So I think let's take one last question. All right. So maybe this question can be answered by Dr. Luke Tan. Right. So how can the quality of life be improved after head and neck cancer treatment?
Yeah, so that's a really good question. I think I'm going to answer it in two parts. I actually did a study on 150 thyroid cancer patients. And for the thyroid cancer patients, I want to say, first of all, that if properly treated, the quality of life is essentially the same as normal people, almost. And that's a different setting, which is a target that we want to try and achieve. For head and neck cancers patients that are related to tongue, to the throat, to the voice box and the nose, to the improvement of quality of life is essentially trying to get them back to the workplace or to their normal functioning. And so, in terms of that, then the treatment would be the best. The best treatment would be to do things that actually give them the least amount of side effects possible. So that's one principle. The other principle is for the patients to understand that they do have to, in some sense, adjust their lifestyle because of the treatment, and like carrying water around, carrying sprays around, and then monitoring for recurrences. And with regards to the recurrences, as a point of encouragement, is that usually the recurrences happen within the first few years. Generally speaking, after 2 years, we are usually more hopeful that things are working out so that you can plan your life and carry on enjoying your life, and not be carrying this burden of I mean, is it coming back? Is it coming back? Although that's always at the back of the patient's mind, but we try and reassure them and do our best to detect anything early coming back again. Yeah.
Thank you, Dr. Tan, for answering that last question. So with that, I want to thank everyone for posting your questions, and of course to both of our speakers for tonight. So Dr. Koh and Dr. Tan, thank you for your sharing and answering all the questions from everyone here tonight. So I think it is now time for the speakers to take a break and for them to take their leave. So once again, thank you so much for sharing your insights. So good night, Dr. Koh, and good night, Dr. Tan.
Thank you, and good
Thank you,
night,
Beth, and thanks
everybody.
to everybody.
Bye.
Good
Good
night.
night.
Bye.
Bye.
Right. So with that, so some of you all may still have questions, right, to ask doctors like Dr. Koh and Dr. Tan from Icon Cancer Center. So you should really consider doing a Yamcha session with our doctors. So do sign up for a closed group online workshop by scanning this QR code on the screen right now. So we have limited slots available for this session, though. So do sign up early. So at this point, we also like and appreciate it if you can complete this feedback on tonight's session. So kindly scan the QR code on the screen to give us your comment. So your honest feedback will enable us to improve and to better serve our beneficiaries. There is also a pinned comment on the Facebook session, so you can click the link right at the top of the comment box. So for now, will be the disclosure for this winners for this Facebook contest. So thank you for participating and congratulations to these winners. So do look out for more contests coming your way. And of course, the winners for this round will be Vivianen Chang, Ying Lily, Asian Angel Ignorant, Zoe Hui and Cai Hui Go. So I do apologize if I pronounce your name incorrectly, and we'll be contacting the winners on how to collect your prizes. So do keep a lookout for that. And our next Facebook Live will be on skin cancer. And this is to understand the risk and treatments available. So it will be on the 12th of May, 8:30, right here on this our Facebook Live platform. So the speaker will be Dr. Shang Yip. He's a senior consultant and a specialist in medical oncology from Icon Cancer Center. So do stay tuned for that. So once again, before we end off, do like and share our social media pages, and do visit both of our social media pages to have up-to-date details on upcoming events and more information on our services that we do provide. And thank you very much for joining us tonight, and also to our sponsors for this session, Icon Cancer Center and Pfizer, our education awareness sponsor. So I hope to see all of you all in the next session. Do take care, stay safe, and good night. Bye-bye.